Did you know some medicines cause forgetfulness? If you've noticed more forgetfulness, brain fog, or trouble concentrating, you might be blaming stress or aging. But what most people don't realize is that some very common medications, ones prescribed every day, can quietly affect memory and brain function over time. In this video, I'll explain 3 widely used medication groups that have been linked to memory problems, what the evidence actually shows, and what safer options may exist. First group, anticholinergic medications. Let's start with the first group. You may not recognize the name, but these drugs are commonly used for things like allergies, bladder problems, sleep and nausea. Examples include medications such as paroxetine, solifenacin, diphenhydramine, doxylamine, promethazine, chlorpheniramine, and amitriptyline, among others. So why do they affect memory? These medications block a brain chemical called acetylcholine, which is essential for memory, learning, and attention. When this chemical is blocked, especially over long periods, memory and thinking can be affected. What the evidence shows. Large studies have shown that long-term use of strong anticholinergic medications is associated with confusion, brain fog, and in older adults, a higher risk of dementia. This doesn't mean one tablet causes dementia, but long-term exposure matters. Second group, benzodiazepines. The second group includes benzodiazepines, such as diazepam and temazepam, commonly prescribed for anxiety or sleep problems. Why they affect memory? These medications work by slowing brain activity. That calming effect can help anxiety or sleep, but it also explains why memory, alertness and focus often take a hit, especially with regular or long-term use. What studies show? Research consistently shows that long-term benzodiazepine use is linked to impaired memory, slower thinking, and increased risk of falls and confusion, particularly in older adults. Third group, antipsychotics medications. The third group is antipsychotic medications, particularly when used in aged care settings. These drugs are often prescribed off-label to manage behaviors such as agitation or aggression. Why this is concerning? In many cases, these medications can cause heavy sedation, confusion, reduced quality of life, and the benefits are often limited, while the risks can be significant. What should you do? So what's the solution? First, never stop any medication suddenly. Always speak to your doctor or pharmacist. But in many cases, there may be safer alternatives. Depending on the situation, there are several strategies that pharmacists and doctors know very well. For example, instead of benzodiazepines for insomnia, pharmacists or doctors can suggest behavioral strategies or using melatonin, which is fairly safer than sleeping pills. For incontinence and bladder issues, instead of anticholinergic medications, you might consider bladder training. Also, if you are using antidepressants, newer antidepressants with lower cognitive risk should replace the older generation of antidepressants. A proper medication review can make a huge difference to brain health. If this topic concerns you, this free book for Amazon subscribers, The Silent Thief, explains which medications may affect memory, safer alternatives, and how to have informed conversations with your doctor about protecting brain health. If you found this helpful, please like and subscribe to Everyday Smart for evidence-based insights that help protect your health and your mind.